Hi, welcome to RMD561, Host Defense and Host Response. I'm your course director, Maureen Richards. I'm going to take you through the entirety of the course and what is expected of you and what you can expect from me and the rest of the course faculty. So I'm your course director. My office is in OMSP, which is at 524 AAC. Here's my email. You can contact me anytime. I have office hours on Tuesdays from 2 to 4 p.m., but I'm also just at my desk a lot of the time. So feel free to stop by OMSP anytime you need something or if you just have a quick question. You can also email me. I try to get back to students within the day, if not the next day. Okay, so what are we actually doing in this course? So we have 10 cases that focus on various presentations of infectious disease as a result of viral infections, bacterial infections, parasitic infections, and fungal infections. We also have a set of 4 vignettes that we'll go through toward the end of the block that go into hypersensitivity or autoimmune disorders. We will touch on various immunodeficiencies, both primary and acquired immunodeficiencies throughout the block, but the bulk of the immunodeficiency discussions that we have will happen in your second year in both the life cycle block and the consolidated cases block, which I am also your course director for in the consolidated cases. So you don't get to get rid of me. Okay, so in this block we have 10 cases, which means we have about 20 sessions, right? Because we have a CBCL and a clinical skills session for each case. There are only 18 readiness assessments, so those are those quizzes that you take at the beginning of the session. There are 2 clinical skills sessions that do not have readiness assessments. The first one that you don't have a readiness assessment for is your Robert May case. That's actually your 3rd case in the block. The reasoning for that is that you actually are going to be doing what's called a physical exam mastery lab that day, in kind of association with the Robert May case. So since you're doing that, and that is a requirement of the course, we decided to drop the readiness assessment from that session. The other session that you don't have a readiness session for is the clinical skills session for the hypersensitivity case, the very last case of the block. And that will be split in 2 ways that time. 2 hours of that time will be spent doing what's called the DISC, which is basically assessing your own leadership style, and that's part of your leadership curriculum. The other 2 hours I'm actually going to use as a block review. So you'll get more information on that as the block rolls out, but I am going to still reserve that time in case anybody would like to review the block prior to the summative exam. You also have a clinical skills assessment, which is kind of part of your summative exam. And there will be a couple review sessions. So there's that one I mentioned at the end, and I'm working with Dr. Beal to see if we can get some extra times on the calendar to review with you guys. And there are a couple cases in this block that will not take up the full 4 hours, and we can use that time for review sessions as well. So keep an eye on those announcements that show up from entrada. I like to use announcements to get information to you guys periodically throughout the block. So that's how a lot of the information will come to you. Okay, so there are 2 formatives. You didn't have formatives in your Foundations of Medicine block, so these are new. So what are they? Formatives take place over the weekend. You have 2 of them in this block. There's one after the Robert May case, and then there's one, I believe, after the Walter Peters case. These will be about 40 questions long. You'll have an hour to do them, and you'll take it at home using a software called Examity. You will get instructions on how to do this from Dr. Grachanik and Maria Sheck right before your Robert May case so that you're all set for your formative exam. If you have any problems, you can always reach out to me or Dr. Grachanik or Maria, and they'll be able to help you figure out what you need to do for the formative exam. The formative exam will have material on it from both the CBCL sessions and the clinical skills sessions. So it'll be kind of your first look at what it looks like to have an assessment from all of these different disciplines and roles in this block. Like I said, it's about 40 questions, and you'll have 90 seconds per item to answer all of the items on that exam before the program logs you out. And then there's one summative exam, which is worth 74% of your grade. So how does this break down? How do you actually pass the host defense course? So you have 2 buckets. You have your knowledge bucket and you have your performance bucket. For your knowledge bucket, it's pretty straightforward. You have to take your readiness assessments. There are 10 CBCL readiness assessments 8 clinical skills readiness assessments, and you get to drop 2. So your 2 lowest scoring, or if like you're really sick and you can't make it one day and you drop that one because you get a 0, that's fine, because you get to drop 2. So that goes for 1% each, or 16% of the grade. You have 2 formative assessments, which are worth 5% each, and that's 10% of the grade. And then the remainder of it comes from the 74%. You have to get at least a 70% on the knowledge kind of bucket of the course in order to pass. In addition to that, you also have to meet these metrics in the performance bucket of the course. So these come largely from our roles curriculum. So for communicator, advocate, leader, and or professional, there will be a couple narrative reflections, and these will be submitted only one time, and you just have to show that you put in reasonable effort to this exercise. There is also the Physical Exam Mastery Lab. You get to continue doing the Physical Exam Mastery Lab until you reach 100%. And Dr. Gupta, who is your practitioner role leader, will walk you through how these work as they're occurring, along with our various simulation labs and Ellen Kate Finley. These people can kind of help you get through your Physical Exam Mastery Labs. For communicator, there is the clinical skills assessment, and that will also work with practitioner. So in that, that's a graded performance, and you have to get a 70%. As long as you get a 70% in the knowledge bucket, a 70% on your ICS, 100% on your mastery assessment, and put in some reasonable effort on this narrative reflection, you'll be fine, and you'll move on to the next block. If not, there is a remediation plan that is listed in the syllabus, and myself and the rest of the discipline directors and role leaders will work with you. Okay, so what about the actual sessions? They're going to run largely similarly to how they ran in Foundations of Medicine. This is kind of a hybrid of a problem-based learning curriculum. It's not actually problem-based because we don't carry questions from session to session. But one of the things that we really wanted to get at with this curriculum is that you guys were doing the teaching. We find that students learn better when they take charge of their own learning. So we do have facilitators in the classroom that are there with some answers in their hands to help guide you through the session. But it's really, we don't want them to give you the answers. We want them to help you find the answers. So they're probably not going to say, yep, that's it, you got it. Instead, they're going to say, okay, that's a good point. What else? And they're going to ask you more questions about it to see how deep you can dig on some of these concepts. So just keep that in mind when you're working with your facilitators. That said, we understand that sometimes you really just want to understand and you want to know what the answer is. Well, for that, contact your discipline directors. We're all really excited to work with you, and it's kind of a new experience for us being not exactly in the room with you all of the time because we're trying to give you a small group learning experience. So throughout your self-study guides, you'll be able to find places where I've listed contact information for all of the discipline directors. You can email us during sessions. You can ask your clinical educator to contact us and ask us to come to the room. We'll be bouncing around from the rooms, myself especially, because I'm your course director for this one. And you can also find other ways to contact us via our office hours, review sessions, anytime we're available to you. So there will be a list that explains who's involved in which case, and I'll show you where to find that. So I'm going to go over to Entrada and show you where everything is there. Okay, so if I log into the Entrada course, you can see it looks very similar to how things looked for the Foundations of Medicine course. So you have the course description, you have me, your course director, Lisa is again your curriculum coordinator, and then you have a whole bunch of faculty, some of who you're probably aware of and some of whom you haven't even met yet. But hopefully you'll get to interact with most of these people during the course of the block. So in the course syllabus folder, you'll find the syllabus, but you're also going to find a Word document of the course objectives, which is right here. The course objectives have not at this point been loaded into Entrada, but you can see them here. It also has my contact information again. You're going to see that everywhere in case you need to contact me. But here are all the course objectives. Now, let's go to some other components of this course. There will be a folder here once again, it hasn't been populated yet, for your histology labs. You have 3 histology labs in this block, one on connective tissue, one on lymphoid organs, and one on skin. The histology lab for connective tissue happens either the same day or right after the CBCL for the very first case, which is Jamie Lopez. In that case, I have included the lecture on connective tissue in your Jamie Lopez CBCL, but the rest of the lab material will be in the histology lab folder. So that's your pre-lab guide and the lab guide itself. So make sure you check out those materials. The reason that in this instance the CT lab is part of the Jamie Lopez CBCL is because it's likely going to show up on your readiness assessment. So I needed you to study it for the CBCL. For all of the other labs, it's going to be separate and it won't be on your readiness assessment, but it will be on your formative and it will be on your summative exams. So do make sure you spend time in your histology lab folder. Otherwise, it's going to go case by case. So let's pull up Jamie Lopez. If we go into Jamie Lopez, you have a couple of documents. So the first thing is the case description. So you're actually seeing a couple things that you don't have access to yet, but you're going to have a case description that you'll be able to open just like you could in Foundations, and that will just show you the case. So in this case, we've got chief complaint of swelling and tenderness in the left leg. Ooh, and you can watch an introduction of the patient, Jamie Lopez. If we go back in the case to the actual RMD561 Jamie Lopez folder, when you open that, there's a folder for clinical skills, a folder for the CBCL, and a folder for the objectives for this session. This sheet shows you every single objective that applies to the Jamie Lopez case, okay? So here are all of my objectives for immunology and microbiology, but there's even objectives down here for psychiatry and practitioner, which is the role that will be covered in the CBCL session. There's also the case discipline directors below. So these are all the discipline directors that have content in this case and how you can contact them, and where I had them, the office hours for that discipline director. So Dr. Bradrick, our pharmacologist, is available these days and times, and how you can contact them if they haven't given me their office hours. A lot of times they won't give me their office hours if their schedule is somewhat fluid, so feel free to contact them and they will certainly make time to meet with you. So if we go back into the case, once we're in the CBCL document, you've got your self-study, and then on the day of the session, the student guide will be released to you so that you can work on it during the session. So let's open up a self-study. So this self-study is a monster, and that's something you're probably going to notice about a lot of the self-studies in the host defense, host response block. I looked through your self-studies for Foundations, and I helped write some of them, but they were roughly about 30 pages. On average, your self-studies in host defense, host response are going to be between 40 and 60 pages. But I am taking pity on you a bit. At the beginning of each self-study, I've got this. It's a video hyperlink to a video on basically how I would go about attacking the cellulitis or the self-study for any case. So here's the Jamie Lopez one, and I kind of take you through the self-study and how you should go about it. So that's the first thing. Watch that little video and it's going to tell you how to get through these various cases. Okay, so now that we've done that, where am I? Ah, here we go. So there will be a video like this at the beginning of most of your self-studies that basically tells you how to get through the self-study. You'll also see that it has a table of contents, and you can click on any of these bolded words and it will take you directly to that section. So this is the immunology section and it took me directly to there. Throughout the document there are also various videos that I've linked. The hyperlinks to the video are here, but if I go to microbiology, it'll also show where the video is in the document, where I would actually recommend you watch it, because now you'll have learned material that is germane to that video and will also follow along with the video afterward. So this is for the entirety of the content, and for histology, here it is. You need this for your histology lab, but you also will have some items on the readiness assessment about this. Okay, you got those mastery questions or study questions. Those are at the end, so I have them all the way down here. So for this case, there are 45 questions that are designed to help you get through the self-study, and they'll be in this position in every single CBCL study guide and in clinical skills study guide. So that's kind of the layout of how they'll work. So when you open a CBCL self-study, watch the video, then go through the case, then go through the entire self-study, watching videos as need be, and using your study questions basically to guide you through the self-study. Then during the session, you'll get an expanded case and you'll get the student guide. After the session is over, you'll also get the answers via the faculty guide, but once it's over for everybody. I'll also release answers to the mastery questions once everybody has completed the session. So that's kind of how things will be laid out on Entrada. If you have any questions moving forward, feel free to contact me. One more thing that I want to take you through is actually looking at the syllabus. If we look at the syllabus for this course, there are a couple of recommended texts and websites. So I just want to give a little bit of a plug on those. So remember, for most of these, they're all available on Clinical Key. So if you're logged into the library, you can access these anywhere. Murray's Medical Microbiology and Disorders of the Immune System is largely what I use, and Dr. Bradrick has some pharmacology texts here, and Dr. Poole has a pathology text here. The other thing I want to talk about here is Sketchy Medical. Sketchy Medical is a series of short cartoon-based videos that students have used to study microbiology. I've found that students have really liked these videos in the past, so I've vetted them, and I'll mention them occasionally throughout the curriculum. I think it's a helpful tool. You are not required to use it, but if you're finding you're kind of having trouble keeping all of these bugs straight, might be something to check out. I'm happy to talk with students about how they use them. That's it for now. Let me know if you have any questions, and I look forward to working with you. Good luck.